are back with our very special guest, fresh off his break up in the mountains of New Hampshire, as well as visiting family up there in Long Island. Franklin Roye, did you have a good vacation and a nice break? I mean, we need breaks, and a lot of us are not really feeling comfortable taking them. How did it all go?
Oh, it was great. I mean, it was. We've been, as you might imagine, as a urgent care type place, extremely intensely busy since the start of this pandemic. So you don't really take time to kind of decompress and deal with the intensity of that. So to get away for a week and really be away from people and spend time with my kids and be outdoors was a nice little reprise.
Did you turn your phone off and stop checking your emails, or were you sort of still working?
Not a chance.
No, too bad.
Still working a bit, but
the curse of modern technology is there's no real vacation anymore unless you just force it. But you've been working 7 days a week. I mean, this is just an intense period of time, as you said, and you had to pivot very quickly, as many businesses did, but you're in the business of healthcare. So for you, it was even more dramatic in many ways than it has been for a retailer. Give us a little bit of a little rundown of how it started coming toward you, and what you were looking at, and when you started planning to make some changes as far as the operation was concerned, the urgent care part of it, and then how to deal as a healthcare provider with the pandemic itself.
Yeah, so I mean, the change happened pretty quick, because when the pandemic first really started, very quickly, two things happened. One, there's a lot of fear among just everyday people that have everyday medical needs about going to a medical facility. So we saw that dramatically impact from the beginning. And then at the same time, from our perspective, we started to quickly think about what role we could play, and how we can be a part of the solution, because I think it's when something like the coronavirus pandemic hits, unfortunately, most people are more victims of it and don't have a lot of ability to do something or be part of the solution. And in healthcare, you have a unique capability to be part of that solution, and also, I guess, a bit of a responsibility. So we kind of just acted upon that pretty quickly, and started looking at ways to do testing, and that was quite a extensive effort to figure out how to do testing, and how to be able to offer that to our community in Hillsborough and surrounding area.
Now, the first thing you did was had a screening process in place that you put together in conjunction with Hillsborough Pharmacy. You guys were already doing flu virus testing, which you would do at people's homes if they wanted it, and now you had this sort of two-pronged concept of going to someone's home after a telemedicine visit to determine if they if they qualified for additional screening. You'd go there, give them a flu test. If they didn't have the flu, then you would then look into getting them tested or referring them to a testing site. Now you're actually doing the testing itself. So you had to, I guess, apply to be considered a testing site. And that whole headache, you were describing it to me. Give us a little capsule of the challenges that you as an independent provider with a small space faced in getting certified as a testing site. And those challenges, I guess, are ongoing as you consider expanding that.
Yeah, so I think it's been multifaceted. So, one of the first challenges was just, although we wanted to do testing, we couldn't get the things we needed to do it, right? So everyone is aware of the shortage of testing supplies in the early going of the pandemic, which faced us as well. But even bigger than that, we couldn't get PPE. We couldn't get gowns. We couldn't get masks. We couldn't get gloves. So it was the first real struggle and effort was figuring out how to get just the basic protective equipment that we needed to even attempt to do testing.
Now, before you continue, it would seem to most people, I think, that as a medical facility, you would be at least better able to access PPE than a lot of businesses that needed it to clean or protect their employees or whatever, but that wasn't the case. How could that be?
No, I mean, the supply lines of PPE shut down right away. I mean, because you have to understand, overwhelmingly, most of these products are made in China. And China shut down, very early on in terms of manufacturing facilities and being able to make and get this stuff out. Then, after they were no longer shut down, they focused on supplying their own needs locally. So even though we work with huge supply companies on the medical side, they really couldn't offer us anything.
Wow. And then as the supplies became more readily available, you were at the bottom of the totem pole, not able to get the supplies, even though some of the larger customers of these large distributors were getting it.
Yeah, I mean, most of these companies look at it very much like a business, right? So they would allocate supplies based on your historical use and ordering of them. And obviously, first and foremost, we're a new business. We're only turned 1 year old in April. So historically, we wouldn't have had a lot of
Happy anniversary, by
Thank
the
you.
way.
And then two, we weren't facing a pandemic before. So, our use of respirator masks and things like that was almost negligible prior to this. So, those avenues weren't really open to us. We had to really open up the Rolodex, as you would say, and reach out to people around the globe to ultimately get ourselves some masks and some of the things that we needed.
So you were basically tapping into the who you know pipeline and just trying to find some source through your extensive contacts developed over the years in this field.
That's right, yeah.
Wow. And so now things have eased up a little bit. Are you more readily able to get a consistent supply of N95 masks and some of the other PPE that you need just for your own regular urgent care business, but now also that you've been certified to be a testing site for that as well?
Yeah, so we still are not able to get stuff through the normal channels, medical supply companies. Some of those efforts to get things from contacts overseas have panned out and have gotten us some good supplies. And then the state of North Carolina has also provided some backfill of certain things on a emergency basis to us as well, which has been helpful.
So that's been, I mean, you must spend hours on the phone just on that one topic, that one issue, trying to get PPE, just on the phone, online. What can I get? Get it to me. How quickly can I get it? That's just one tiny component. It's not small, but it's one component of many, many considerations that you're dealing with on a day-to-day basis. So eventually you felt comfortable, as far as PPE was concerned, to apply to be a testing site. And how was that process? Was it relatively smooth, or did you have to fill out reams of paperwork to demonstrate your ability to do it safely?
Yeah, no, that process was pretty straightforward. You're really accountable for yourself and your own policies and procedures and safety measures and controls. So, we set those things up. You attest to what testing you can do, what type of testing you can do. And that process to get, listed with the state was pretty simple, actually.
Okay.
Yeah.
So you were approved, and then you had to figure out how to make it work in your small space. And you've tried a bunch of different things and looked at dozens of different kinds of plans and options for you. And now you're looking to actually expand to a kind of drive-through setup. But tell us about how you approached this issue of creating your space so that you could do testing safely and continue to do your urgent care work.
Yeah, so we pretty much had to close down almost all in-person visits into the clinic, right, and shift all of that to video visits and telemedicine. And then after those visits, we would coordinate to be able to have people drive up and get tested. As you can imagine, if that was just, come whenever, it could get a little out of control. So we
just drop on by.
Yeah. So we learned pretty quickly that we had to control that by setting up specific windows where people can come up and give a specimen to get tested. That also helps us manage our supply of PPE, because if you're putting on a new gown and new gloves and new mask, 20 times a day to keep going outside, you're going to run through that pretty quickly. Whereas if you bring all the testing into specific windows, it's kind of like a bolus of stuff that you're doing, and you're able to conserve some of your PPE that way and just manage it better. So that's where we're at now. Is we do 2 windows a day of an hour each, where people who have had a visit with one of our medical providers can then come up and get swabbed and get tested.
Okay. Are you doing strictly testing for the virus itself, not antibody testing, or are you doing that as well?
We're doing an antibody testing as well.
What about the accuracy of that? I mean, there are a number of antibody tests, some of them apparently more accurate than others, but a lot of false negatives on that. And it's not clear that the antibody testing is really telling us a whole lot. What is your sense of all of that?
Yeah. So there's 2 big categories of antibody tests. You have the tests that require a venous blood draw out of your arm, and that's done in a lab, and you usually get those results within about 24 hours. That test is very, very, very accurate at detecting antibodies, almost 100% sensitive. So we've seen a big shift. Once those became available, most people are opting to go that route to get their antibody testing. Now, what does it tell us? Well, all we can say right now is antibodies provide some protection, right, against being infected with the virus. For how long that protection lasts, we don't know. If you have antibodies that were developed to one strain of the virus, does it protect you for another one? We don't know.
It tells you you've been exposed, first and foremost, but it doesn't tell you that you have any kind of immunity.
Yeah, immunity is something we cannot say right at this point about antibodies. Well, all we know so far is we've yet to see a true case of someone getting infected with coronavirus, fully recovering, and then getting infected a second time. So that's the indicator that we have right now, that there is some protection. We would never go as far right now to say that means you're immune, because again, we don't know how long. We don't know if there's a level of antibodies that's protective versus a level below which it's not. And we don't know if it's protective against different strains. I mean, if you think about the flu, right, either you get the flu each year or you get a vaccine each year, and that gives you antibodies against that strain.
Right.
But the next year, it doesn't protect you because a different strain comes around. So that may be similar with coronavirus. We don't know.
We just don't know. There's so many unknowns still as to what this thing even is and how it works. As far as the testing for the virus itself, are there options as far as what kind of test, and how did you decide which one to go with?
Well, we had to go with the one that we could get. so that was the main factor in deciding.
Well, that made it a little easier.
Yeah. But, the diagnostic tests, which are called molecular tests or PCR tests, are all pretty much very, very similar. So if you're getting a test that's run by LabCorp, or a test that's run by Quest, or a test that's run by Mako Labs, which is the lab that we use, they're all using very, very similar technology with similar accuracy. There's not really much difference from one to the next. And so what we know about that test is it's really, really accurate at detecting the virus if the virus is on the swab. Where the accuracy falls off is a lot of times there may not be virus on the swab that ends up in the lab because maybe the collection of the specimen wasn't done exactly right, or what we also see is from person to person, there appears to be a difference in where the virus is kind of locating itself. So you could do a nasal swab in someone, and that swab could be negative, and you could do a saliva test in the same person, and the saliva test could be positive. So there's these variables from person to person that are hard to understand yet that lead to some missed positive cases with the testing that we have now.
That's disturbing.
Yeah.
And of course, if someone comes in, gets swabbed with a nasal swab, and then is still having symptoms or test positive later, then they would point the finger at you. Have patients been generally understanding about all these vagaries, or is everyone so like wound up tight that you're seeing a lot of anxiety that comes out in the interactions?
Yeah, there's a tremendous amount of anxiety. There's just as much confusion, right, about testing in general, when to get tested, who should be tested, what do the results mean if it's negative, what do they mean if it's positive. So we really try to put a lot of effort into counseling and talking people through those things. We also, as you can imagine, it gets more complicated if you're an employer in the workplace and how to deal with this and how to deal with testing. So we try to really work hand in hand with patients and employers to kind of navigate based off of what we know at this moment in time.
Wow, okay. Now you're looking at expanding your testing capacity, maybe having a little drive-through tent, or somehow dealing with the space in front of your building. Previously, this sort of these 2 windows per day that you have, people are walking up to the front door. How is this working?
No. So the way it works now is after you've had your visit with one of our medical providers, they'll say, okay, these are the slots we have available for you to come up. You choose one, and then when you drive up to the parking lot where our building is, you just text or call us, and you stay in your car. And then someone who's got protective equipment on will come out and just take the swab directly from your car, and that's the safest way to do it.
So it's a drive up.
Yeah.
Yeah.
Curbside.
Okay. Curbside.
Yeah.
But you are looking at adjusting some of the physical space in front of you. There's the old ATM site. We're talking about Boone Square, if you're familiar with it, where IndyCare and where Hillsborough Pharmacy are located side by side. And you're trying to work with the town to figure that out at this point?
Yeah, so we do have a plan to, and we're always looking for ways to make this better and safer. So, the drive up has been working well, but there is some randomness to it, right? I mean, people drive up and park in one side of the parking lot or another side or right in front. So there's more kind of moving around than we'd like to see. So what we're working on is a plan with the town to set up a semi-permanent dedicated area in that parking lot where people will just drive up, give a specimen, and drive away, and we can kind of control the flow and where people are and how people are moving a little better.
Now, you're monitoring the results of this testing and I guess reporting it to the state. There's a protocol for doing that?
Yeah, so the labs actually automatically report any positives to the health department. The health department then usually engages with that patient and starts the process of contact tracing to find out who they may have been in close contact with, so that they can try to get in touch with those people and let them know that they've been exposed to someone positive, to be extra careful, to isolate, and what the protocol is, as well as, if necessary, offer them testing.
This is the county health department?
Yes, correct.
Okay. And you get also, I imagine, the results back. What are we seeing as far as your testing? Does it mirror what the percentages and the numbers that we see elsewhere, 9, 10%? Do we have a different clientele here?
It mirrors that. I mean, it's interesting to watch the trends of this over the months. We've seen interesting trends in who is getting tested, I would say, as well as definitely a trend recently towards more positives. which mirrors kind of what's happening in the state. But yeah, it's been interesting for me to kind of watch more the trend of the waves of who's getting tested or why they're getting tested. In the early days, it was a lot of individuals who were sick earlier in the year and wanted antibody testing, a lot of that. Then it kind of transitioned to people who had symptoms now and wanted diagnostic testing. And then it transitioned from that to a lot of people who were exposed to someone who was positive at their work. You started to see that once North Carolina started to open back up. And that was a trend for a few weeks. More recently, we're seeing a lot of family groups that are getting tested, where, 3, 4, 2 individuals in a household that are getting tested together for a reason. Someone got sick, someone got exposed. So you do see these kind of bi-weekly variations in the trends of who's getting tested, but we have seen the positives increase over the past month.
And we're talking about Hillsborough residents in many cases here. Is that right? Or are people coming to you from all over Orange County to the west and east, and also even beyond the county boundaries, because you are not a hospital, you're an independent testing site, you're very accessible, you have these telemedicine visits in this process. It's pretty user-friendly. Are you seeing people from all over the place, or are we really talking mostly about local folks here?
Yeah, we're seeing from all over. I think testing has expanded across the state. So 2 months ago, we were getting people from Raleigh, and even, down in Pittsburgh and Burlington coming to us because of the limited options. Those, I think, have improved. But in Orange County, we're still the only testing site outside of the UNC hospital.
Yeah.
So it's a lot of Orange County folks, a lot of people from Mebane, but a lot of Hillsborough and bordering areas that we're mostly seeing.
Now, we've seen other cities, Durham and Raleigh, some of the drugstore chains have opened up drive-through testing sites. I think a CVS in Durham, or I can't remember which is which, but why aren't they all doing that? And why are you still the only independent, freestanding testing site in Orange County besides the hospitals?
Yeah, so I think the when you look at the chain pharmacies that are in testing, predominantly they're doing that under a government contract, right? A federal contract, where Health and Human Services has worked out an arrangement with CVS and Walgreens and Walmart. So it's easier to expand with that arrangement because it's not so complicated. For independents, you're mostly stuck with doing this and arranging it through conventional health insurance means.
Uh-oh.
Yeah. So there's a big burden administratively that comes along with that. And unfortunately, there's not the health insurance companies, while they've done a great job of, the CARES Act has forced them to pay for this, right, for anyone who qualifies. And so that coverage is there, and people don't have to pay for it. What they haven't done yet is really adjust what they pay to account for, the cost and the difficulty of doing this for medical practice. Mm. Some of the things we talked about earlier, not only getting PPE, but how much it costs.
Right.
You're talking about the average N95 respirator mask probably costs $4 or $5 a piece. A gown, you're looking at $7 to $10.
Right. Way more than it did before all this began.
Yeah. So just the equipment you put on to test someone can cost $20, and you don't get paid to collect that specimen. So that's a challenge, I think, for a lot of independents to navigate in the face of that, and it's hard. So I think that's why you don't see more independent places stepping up to do testing. Well,
Franklin Roye, CEO, founder, chief operating officer, or do you have one of those? Anyway, pretty much the factotum for IndyCare, our own independent urgent care facility, still open 7 days a week, IndyCareHealth.com. Got to ask, what do you see in front of us? It's all a guessing game, but A lot of people obviously concerned at the increasing numbers, which are related to the increasing numbers of tests. So the percentage of positives has inched up from 7 to 8 to 9 to 10. It's hovering around 9 or 10 right now. But meanwhile, schools are getting ready to go back in session. There's a lot of confusion about how they're going to pull any of this off. Are you personally and as a healthcare provider concerned about just the great unknowns? And of course, you see people who don't quite understand the fine points of even mask wearing. People don't wear masks the right way. I see it all the time. And just that one thing alone, which is only one piece, there's, people are tired of social distancing. They're packing into bars. What does all this portend for us here in town and also elsewhere throughout the Triangle?
Yeah. Well, look, I think we all can kind of see right now that things are not quite moving in the right direction. So that's concerning. But at the same time, I think the things we have to do to improve it are not actually that complicated. I think we have a good understanding now that social distancing works. We have a good understanding that wearing masks work. So these are things that are inconvenient and uncomfortable at times, but can definitely be done to help us change the direction of things as a community, as a society. The things that we are on our mind right now is more about how are we going to navigate this come the fall, when you have back to school, you have cold and flu season. Right now, we can see patients on telemedicine on a video visit and assess them. And, if you have these cold and flu type symptoms, there's a good chance that it could be COVID-19 because cold and flu is not around. Come the fall, you can imagine a patient that presents with a fever, a cough, a shortness of breath, these headache, chills. It could be a multitude of things from flu to pneumonia to COVID-19 to bronchitis. And being able to determine what it is over a video is nearly impossible. So I think come the fall, our challenge as a healthcare organization becomes even more difficult because we need to figure out a way to have almost not only curbside testing, but really like curbside clinic, right, where people can drive up, be tested on the spot for a multitude of things, flu and strep and COVID, and get that result right there and then within minutes to then help that medical provider determine what's going on and how to treat this person. So that's kind of what we're looking at and where we're actively strategizing around how we can execute on that sort of service come the fall, because it's going to be really hard to navigate this when you drop the rest of the respiratory illnesses on top of potentially COVID.
This strikes me as a challenge of epic proportions, and all I can say is good luck with it. We would appreciate it if you would check in with us periodically as we move through this and let us know how it's going, both from a personal and professional standpoint, and as far as how IndyCare is doing. Business is okay at this point?
Yeah, I mean, we don't have much time to think about business right now. Our schedule is full of patients every day, most of them related to COVID-19. So, we're just continuing to try to serve the community, stay safe, keep our patients safe, and try to make a difference, in all of this.
All right. Well, Franklin Roye, IndyCareHealth.com. And you can check into all their services as well as their partnerships with Hillsborough Pharmacy, NC.com. Good luck, and we look forward to our next update.
Thanks, Bob.